I think the first few patients that I met who had pelvic floor disorders really struck me, and I felt connected to the struggles they were facing in their quality of life. And then seeing what we could do surgically, medically to restore that quality of life and give them the opportunity to jump on a trampoline again and train for the marathon they had always wanted to, or maybe just feel more confident in simply leaving the house, or feel more confident in their intimacy and relationship with their partner. Seeing those patients and then seeing those patient outcomes really called me to this profession. So physical activity, and a lot of times that'll involve exercise, or it could just be functional for the physical activity. Picking up your 2-year-old off the floor and bringing them to your hip, right? The dog that jumps on you that you're taking out for a walk, picking up the Amazon box at the front door. Any of those types of activities can cause pressure to come to the pelvic floor, and that pressure may cause pelvic floor symptoms to develop, including urinary incontinence, prolapse, and other symptoms that patients may notice. Simply a pressure or a heaviness in the pelvic floor may be noticed by patients. Actually, that's often what causes patients to start to limit their physical activity. And we all know movement is medicine. Being up, moving around, being active is what keeps us healthy over the long run. So we want to help to encourage our patients to continue to stay active. So when you start to have those symptoms and there's that natural inclination to say, I'm going to pull back and stop doing these activities, that's really a good time to say, maybe I need to seek out assessment or evaluation for these symptoms. Pelvic floor physical therapy works hand in hand with what a urogynecologist does. And many times patients will benefit from pelvic floor physical therapy with surgery, after surgery, before surgery. There's a lot of different positive benefits that you get from pelvic floor physical therapy. Certainly one of which is our pelvic floor physical therapist team here at WashU is really exceptionally talented and wonderful at counseling and helping patients understand the pelvic floor itself. And so many symptoms that some women may not have even realized were due to their pelvic floor, that process can be very educational and informational as well as therapeutic. One of the most satisfying experiences I have with a patient is post-operatively when she will say, I was sneezing last week, getting ready for work, and I didn't leak. I bent over to pick up my grandbaby and I didn't leak. And those are things that women don't share a lot with a large number of people, because sometimes they feel embarrassed, they can feel isolated, maybe even marginalized by pelvic floor disorder symptoms. So to know that they feel that sense of confidence again is very gratifying, and it's just really meaningful work to know that there was a part that I could play in that. So there's certainly a spectrum of symptoms that patients will have, and a severity of the symptoms that they will have. So for patients who say, I have this on a very rare occasion, it doesn't stop me from doing my regular activities, I'm living life. Great, live life, enjoy it. For patients though who say, I'm starting to pull out of social settings, I have changed my physical workouts, I am not putting myself in this position anymore because I'm worried that there will be a symptom that I have that could trouble me, whatever that might be. And for some patients that is a social setting, for some it is physical activity. It can even, start to bleed into work and intimacy. And so when patients have started to say, I can't be who I want to be to my fullest ability, this is limiting to me, that's a good time to say, I want to reach out. Active listening is so critical in what we do as physicians across the board, to really hear a patient's history and story and symptoms, but on top of that, to be able to connect with them, because these are very thought to be more private, personal symptoms that they might not feel comfortable sharing in book club, or even with their partner, they might feel embarrassed. So letting them know, I'm really glad you came today. I say that a lot. I'm really glad you came today. We're happy that you're here. To help give them that understanding that we acknowledge what you're saying and we hear you, and let's talk about what some options are for treatment. Urogynecology as a field treats a wide range of disorders, from pelvic organ prolapse, which many women will notice by a symptom of a bulge in the vagina or heaviness. We treat urinary incontinence. That might be stress incontinence or urge incontinence. We treat patients who have accidental leakage of stool. We treat patients who have had childbirth injuries, or maybe there's been a surgery that they've had that didn't have the outcome that they were hoping for. There may have been a challenging part of the surgery that now they're coming to see us for. Anything really from the pelvic floor is going to be something that our practice will help take care of. If I were to tell a patient, here's an important part of your history to be aware of, it's simply listen to your body. Listen to your body, and when things seem not quite right, starting with your general OBGYN is a great place to start. Some symptoms are at times advanced to a degree that patients will present directly to us as well. So we see patients from referral from their OBGYN or from their primary care provider. We see patients from self-referrals. The good news is that more and more women are beginning to talk about this. And the more that we continue to educate and make it okay to talk about pelvic floor disorders, I do believe the more women are going to feel comfortable to step forward. It's hard to prevent pelvic floor disorders. There's a number of reasons why patients may have a risk factor, ranging from childbirth to occupation and lifting, to other neurologic disorders, to some multifactorial hereditary components that we're just beginning to learn more and more about. So there's not one tip or trick to prevent pelvic floor disorders. I think it's more about educating patients that they happen with a greater deal of frequency than what probably many women would expect. You know, it may sound very, very simple, but I've always been from the school of thought, take really good care of patients. Take really good care of patients. Focus on the outcomes that they are looking for. Understand what their desire is, what their future state is, what their goals are, and then align with them. And here's what surgery can do to help that, or here's what surgery can't do to help that, but perhaps physical therapy would be a great option. Maybe it's a medication or a neuromodulation. There's a lot of different treatments, but I think it just comes down to understanding what is the patient really looking for. Coming back to that active listening piece of understanding what is the part of their symptoms that troubles them the most, and then sharing my expertise of what I know, of what the capabilities of surgery are, of what medication opportunities are out there, of what physical therapy offers across the pelvic floor disorder continuum, piecing all of that together for patients. It may be all three of those things. It may be that we stage the treatment options going from one to the next to the next, but ultimately the goals of the patient to me really sit at the center, and that may not be new news, but that is the foundation of what we do to make sure patients get great outcomes. I'm originally from a small town in Iowa, in kind of the middle of farmland, Iowa. In May of 2023, I was honored with the distinction of the ACOG Outstanding Service Award, and that was recognized for the work that I have done with our resident and fellow physicians, so our physicians that are still in a stage of learning and acquiring the skill to be an OBGYN or progressing into fellowship training. And it was really centered around the research that we've done with medical education within our ACOG district and helping to advance curriculum and objectives across that. Some patients will find like a bladder diary or some type of journaling of symptoms to be helpful, because maybe their symptoms are linked to their menstrual cycles, maybe they're not. Maybe their symptoms are tied to certain foods, maybe they're not. Regularity of bowel movements, the amount that they're voiding, all of those different daily activities that we don't really take note of. We drink coffee when we drink coffee, and we do physical activity when we do it. We're not necessarily planning it all out, but sometimes those types of journaling exercises can help patients in understanding what makes their symptoms better or what might make their symptoms worse. And that can be very fruitful for us in understanding and trying to tease out the diagnosis that a patient might have. That could be helpful, but we also have a lot of patients who just come and say, all I know is that I change a pad 4 times a day and I can't keep doing that. So, don't be burdened by feeling like you must do homework before you come to the doctor's office. But if you do have that sense of, these are when my symptoms are most troublesome to me, those reflection points can be really helpful too. I know this is simple. Listen to the patient. Listen to the patient. She will tell you. The symptoms will tell you. The signs will tell you. Listen to that voice in the back of your head when something doesn't quite add up, when there's a concern. That usually is something that you should pay attention to. And there's so many skills that we can continue to advance in our communications with patients, making patients feel heard, acknowledged. That then transpires into how we educate them back, the listening, but then also the counseling. What are the options? What do they look like? Doing that in a way that doesn't make patients feel as though you are talking them into any one approach, but also being able to offer your expertise in a non-biased way is important. That's why they're coming to see us. So really continuing to exercise those skills and helping to maintain that tight connection with the patient through our dialogue is equally as important as everything I do in the operating room. The instinct that you have as a patient, we've all been a patient before, and that instinct says, I'm being heard or I'm not being heard. I can trust this person. That's what we want to generate with our patients. That's the feeling we want them to walk away with. We can't fix everything, unfortunately. There are some things due to the aging body and other physiologic changes that we aren't going to be able to alter. But every day we can make sure that patient walks away heard. My path to this point has been exactly the way it's supposed to be. And I truly think it's hard to look back and say, what would I have done differently? The windshield is bigger than the rearview mirror for a reason. We look forward, and every choice I've made along the way to lead me to this career, I wouldn't change for a second. And so it's really hard to think about where else would I be. There's so many other things I enjoy doing, whether it's, being physically active or being in a fun social hospitality setting. I like problem solving, but I can't imagine being an engineer per se on a daily basis. So that's a really great question. I'm not sure exactly where I would go with that. I really enjoy the process of patient advocacy. So perhaps there would be a future that even at some time could go hand in hand with my role as a physician in being on a larger scale involved with patient advocacy. Patients have pelvic floor disorders that are interfering or bothering their life in some way. They come looking for a number of different options, and we can offer all of those here. For some patients, the best option that they might be interested in is pursuing a non-surgical approach. Some patients, though, are looking just to have something fixed, and they want to pursue surgery. And we have that ability to help streamline your first appointment with us through the process of preoperative evaluation, surgery, and then bringing you back and seeing what those outcomes are after that surgery. We want to make sure patients know that no matter what they're looking for, we are happy to give them the options, the counseling, and offer our expertise about what may be the next best choice for them. Patients typically will see us for their initial consultation, and then depending upon how ready they might be to initiate a treatment, whether that is moving forward with surgery or initiating a non-surgical treatment, we'll get that ball rolling. And we want to make sure that when someone has expressed the desire to say, I'm done dealing with this, I want my quality of life to change, I'm limiting myself, and I want to go live life, that we participate in really helping to expedite that process. Timely care. So that might be moving them into the referral network for maybe another subspecialist, or maybe it is for physical therapy, or if it aligns with what our surgeries can offer for a patient, let's get moving in that direction. That might mean additional testing, might mean meeting with the anesthesia team before, and then let's move forward and get you set up so you can get back to enjoying life the way that you want to enjoy it. For patients who are avoiding seeking care because they are embarrassed or worried about their symptoms, or they think something might be wrong with them, please come forward. Please come see us. We have a great team here, from our academic specialists in OBGYN that care for the breadth and depth of women's health care to our specialist team. We are excited to see you and help take care of you. Don't be afraid to come see us.